If you're wondering why I don't have two checkered ones, it's because my right marker is probably either in laundry or like stuck to a patient's butt somewhere. I'm not sure. I got my new markers from Mitten Markers. I'll tag her below. So I'm gonna put rad adhesive on them and change out. I have 2 badges, so I'm gonna change out the rad adhesive. And let's talk about why I became a rad tech instead of a nurse, because I keep getting that in my comment section. So many of you don't know though, we use x-ray markers in x-ray because these letters are made of lead and it'll tell the radiologist like the laterality, and it has our initials, so we're like responsible for that image. Before you tell me I can clean these, I know I've cleaned them 700 times and it's time to just change out the rad adhesive. During COVID, I worked as a CNA, and before COVID, and I just didn't love it. I don't love patient care. You know, shoot me, I just don't. I like helping patients because it's a gratifying feeling. I don't like cleaning up GI bleed off the floor. Like, I don't like having to sit one-to-ones with combative patients. There's just a lot that I learned while I was a CNA that made me like steer away from nursing. There's a lot of parts of nursing that just aren't talked about. If you clock in and your patient load is like 8 total care, terrible, fallen on the floor patients, you can't leave. That's called patient abandonment, and you can lose your license. You can file a safe harbor, but like if you just quit on the spot, your license could be in jeopardy. You have to stick these on something before you stick it on, or you won't be able to get it off. Anyways, I have people all the time that are like, why did you decide to not become a nurse? I'm like, nursing sucks. I'm sorry, I'll say it. My sisters both want to go to school for nursing, and I'm like, don't. It's a trap. It literally is a trap. With radiology, I have just the right amount of patient care. I get to come into a room, see a patient, make a genuine connection with them, take their x-rays, and then at the end of it, like, I can go get them a warm blanket, you know, I can get them comfortable in bed, and I'm not burnt out of that patient because I'm only in there for 5 or 10 minutes. Okay, honest to God, that is the cutest thing I've ever seen in my life. Let me do the other one. You guys go to her shop. Her markers are literally the cutest, and they last forever unless you lose them, so